sitting down with Dr. Richard Ferguson. I know him from triathlon, so everyone should know that. He's an awesome athlete and a great swim buddy. But I'd love to hear about some of your work with BPOU and how you're helping people in Utah.
Yeah, so I would say right now they're in the current corporate climate, also which applies unfortunately to our capitalistic healthcare systems, because many are for profit, even though many are nonprofit, but they have to put all that money they make somewhere. Usually it's a hospital or a clinic. But right now you have those that are, I would say, non-allied BIPOC leaders that are in healthcare systems are creating sort of, it's trendy right now to have a DEI head or a DEI leader. And sometimes I think they're doing it to check a box. They're saying, obviously, I care about diversity, when often they're not, because they're missing the inclusion part, right? There's one, and then sometimes they will have a tokenized diversity hire, which is what we don't want to have, right? We want qualified people to be vetted and evaluated and hired that add value to an organization. And also you don't want to put that, sometimes I'm seeing people that are in these DEI positions to address equity in a company or organization, particularly within healthcare. And I say, well, you're Black or you happen to be brown, so you must understand what I need to do. When actually there's training that kind of goes along with that, where I see there's this gap sometimes. So that's where I feel sometimes, although some people say, well, why you as a Black organization might know that. Well, we have training, I have some experience. My breadth of physicians have been working, there's several hundred years of experience probably collectively amongst the docs, where we can understand how health equity can occur and what are some major steps that either needs to occur with legislation, for-profit groups, nonprofits, venture capital groups to address it in public health sector. Because it's not going to be addressed just by pointing a finger at one institution, because it is structural, it is systemic, to kind of undo these lingering and continuing effects of racism. So health equity is one of our goals of BPOU. And they almost everything, though, from our mission of building a community where we want to have the Black community live a healthier life through increased education awareness and increasing access to care, but also increasing access to care often to BIPOC providers that likely have cultural competency to best understand the needs of that patient or that population. They don't necessarily need to be of color to be able to do that. There are many allies that BPOU would not be where it's at today if it wasn't for their support. And then mentoring future physicians. So that's where we as the docs are the trusted messengers that are trying to convince many of the young Black youth here in the state to say, if you can see it, you can be it. And so it's kind of weird sometimes for me now to see, just having touched or met a few Black pre-med students, or two that I convinced to be pre-med that were kind of on the fence, but now they're like, oh, wow, I'm applying to med school. You really think I can do it, Dr. Ferguson? Yes, I can. And I can't disclose this, of course, when I'm on the committee, but I'm on the admissions committee for University of Utah School of Medicine. And I can now read their AMCAS and their personal statements and actually reference the organization now and say, Dr. Ferguson was the first Black doctor I met, or the second Black doctor I ever met in my life, and I'm 21 years old. He inspires, now, mind you, that's probably like ego stroking, right? But as I see more and more of our mentees that we're kind of putting this fire into, showing this light that you can reach the goal, you can become like us, it's much more realized. And we're hoping along the process, we're teaching them the difference between equality and equity, because sometimes people aren't able to discern the difference.
Right.
Equality isn't enough, right?
And they sound similar, so it's confusing, right?
BPOU exists because I feel there is a need, or at least through my organization, I can address health disparities, these health inequities in the state through increasing representation. That's just one part. Mind you, almost every activity, I always make sure that students are engaged and involved, so that they are meeting with members of the public. They're educating members of the public, because we don't want docs often are seen as being disconnected They're in their sort of elite medical jargon world, and they don't have as much contact with the community. And so one thing that I do is we're often doing an event where that blends, that mixes, so that people can feel they can trust you, because that's one thing that leads to poor health outcomes, right? Nationally, there's a lack of trust. Many African Americans have a lack of trust. Black Americans have a lack of trust when seeking healthcare. Either sometimes they felt they've been dismissed, they don't trust what they're going to receive, or they feel they're not heard. And so we want to try to say, we are Black doctors, we hear you. We can even sometimes make those same errors of dismissing, but we're less likely to, and we want to try to empower the Black community as well on how to take more control of their health. So that's our kind of building community engagement side. So we've got youth, which we're trying to focus on to address within Utah itself specifically. If there's more Black doctors, we're probably going to have increased compassion, cultural competent care, less likely to have less racial bias when imparting care. And this can then, I would say, influence their colleagues that will likely be non-Black.
Yeah, I really liked how you were starting to talk too about like equity versus equality. And I saw too that you're having specific events, like you have a 5K and you're having an immersion day. Do you want to talk about those events? Which one would you, choose your own adventure. Which one would you rather go to?
Yeah, so let's start with Medicine Immersion Day. So Medicine Immersion Day is something that I've had I'm originally from Washington, D.C., and finding a Black physician, knowing a Black physician isn't unusual there. I grew up, being taken to a Black pediatrician. If the only thing, it might have not knowing that I could aspire to be a physician, the only thing that probably would have prevented me would have been to the lower middle class that I was kind of like born into, or just not being in the right schools. But I never thought I couldn't be a doc. It just was there a desire. Well, very early on, being around prominent Black institutions like Howard University, even University of Pittsburgh, when my mother remarried and I went up there were programs for underrepresented minority students, often Black and Latino, in inner city Pittsburgh and also DC, where they took junior high students or high school students and they took them to a med school. And they had and it was like every Thursday or Monday evening, we would sit through an anatomy or physiology lecture or something that covers disease. After going to school all day, yes, I would occasionally nod off, but all of us were excited to eventually go to a anatomy lab or cadaver lab afterwards. And so now, mind you, did everybody there go on to become a doc? All it takes is changing the mind or presenting that path to a few of those students in the room, and you get someone like me today, where they keep charging towards that particular goal and not trying to let much get in their way, because it's, oh, wow, I enjoyed it. I'm glad someone presented this to me. That's what I'm trying to do here in Utah, because many, just like myself, I'm a transplant. I cannot point to the 40-some Black physicians in the state that are from here. Let that resonate, that are from here, educated and from here. They're transplants, meaning we were able to probably come from Black communities where there was enough folks that kind of cared, and they encouraged us to aspire to become physicians. That's not
sort of chilling that you couldn't, I'm sure that someone will watch it that falls in that group and they'll respond, but you're right. Like they're transplants.
There is one, I guess I would say, in my group, Dr. Baden, but she's I think born in Ghana. I think originally came over a little bit later, went to University of Utah. So she would probably be the outlier because she went to University of Utah, I believe, for med school, and then like Weber State, I think, for undergrad. So she might be one, but the vast majority are all transplants. So, and many of us are highly subspecialized, meaning we're not sometimes in the areas where most of the Black community wants to see us. They can't see us. And so that's another sort of dearth or need I'm trying to address. I'm family medicine boarded, only worked in emergency medicine, and now I'm admin. Well, there's no more family physicians after Dr. Baden, who's now gone into a specialty clinic to meet those needs. So constantly on my Facebook page, website, they're like, hey, is there primary care? I'm like, hey, that's going to take a couple of years in the making. But Medicine Immersion Day, got off topic, is to present a pathway for young Black students, high school seniors, undergrads, on where they're going to hear about the experience that led to these Black physicians going into medicine and what was their path. And then they're going to have throughout that day hands-on simulations that occur in various specialties, either with OB-GYN, with anesthesia, with surgery. They're going to have simulated ultrasound devices sort of in one room. We're going to visit an L&D unit. We're going to go to an OR. We're going to have anesthesia and surgeon there to kind of present a case, or just walk through like, all right, this is how I have to gown to be able to go into an OR suite. Many students may have never been in an OR, may have never seen it besides on television. We want to try to make this more real. So
Right.
What I am hoping to do from that, and then some small case discussions, and then a mentor-mentee lunch where I'm having Black physicians and our allied providers come in and just mix with these students, because often it started in high school with me. And so that's one big event, first of its kind in Utah, targeting, of course, Black youth. And the next is kind of public for everyone, but really I'm trying to target the Black community there. And that's our family fitness 5K run walk. And so that is being done because I want to address obesity within the Black population, particularly obesity amongst Black females. And that almost ties a little bit to a lot of my work so far that I've done with education and awareness for the worst maternal fetal outcomes that Black women have compared to white women in our nation. If you're able to have, so if you do get pregnant and you're obese, you're already kind of at high risk. So let's try to reduce disease burden for all conditions so we can improve our outcomes. And I'm just trying to make it fun, accessible. It doesn't take a lot of work to be able to run, walk, or attend a yoga class to improve wellness, reduce stress in your life. And I'm also tired of being alone at almost every event I go to.
Yeah. Like at all the triathlon events.
Yeah.
They're great.
But no, but that's an event that will be Legacy Park, just a little quick run out, Legacy Parkway Trail. We're going to have nutritionists there because I often feel and this isn't a health fair. I don't, Black folks are told enough. You're high risk in this category. You're high risk in this category. Go see this doctor. They're just kind of told negative news all the time. And I want to try to say, no, this is going to be fun. And then we're actually going to have some guidance here. And so we're going to have personal trainers, health coaches, Peak Wellness from University of Utah, where people can just kind of go up at their leisure or through a raffle prize I'm giving away to say, oh yeah, I would love to, I've never attended a nutrition class. I don't know, I think I'm healthy. Could I do better? And so that's what I want to try to do with this event, but it's open to everyone because often we're too small a community to pack it ourselves.
Right.
What brought you to Utah and what is keeping you in Utah in terms of the, creating BPOU and what it can do for the community there? Because I think some might just decide to, go to a place where there are more Black doctors.
Yeah, so that's an easy excuse, right? It is very easy to complain and do nothing to impart change. And I wasn't kind of raised that way. But how I came here, I got out of the Army here, did a short little stint at Fort Douglas when I was exiting, and started as a second year in a family medicine program. Once I graduated, there really wasn't much of many jobs available, particularly for what I wanted to do, which was emergency medicine. And I had a background in it coming from the Army. And I knew there was jobs that I could get for it. So I left the state, but I stayed in the state because I enjoyed sort of the recreation, my lifestyle being also much more affordable than relocating back to DC. But one thing I noticed, because for 4 years, I flew to West Virginia. So probably one of the whitest states in the U.S., far more homogenous than Utah. But many people are shocked by that. I'm like, well, you have like like 16% Latino here. You know, that is a like 96% white state, which
Right.
surprisingly has an HBCU, which people are shocked. I'm like, yeah, but it's majority by attended by majority white folks.
Right, right.
But yeah, West Virginia, not that diverse. So I'm working in a place where there's 2 Black people, when they would come to the ER, I would know them. It's in Parkersburg, West Virginia. But when I'll come back to Utah, I did have my sort of cohort, peer group of friends, Black and non-BIPOC, and I was comfortable with that. What eventually sort of pushed me to want to develop BPOU is I felt that when I did take a job here with Intermountain in 2016, I was always the only Black doctor I saw. I was in part of the large urgent care group. I think there still isn't any Black physicians there, part of the urgent care group. I think the urgent care group consists of about maybe 120, 140 docs statewide. But even when I didn't stay in, even when I was going through training and went through Intermountain facilities, there were no Black doctors. And I also started, I think that also led to me leaving Intermountain. You know, there was that, they had an EDI committee or DEI committee with no Black people on it. It was all white women. So I was like, Intermountain, this is not, I think, a healthy space. And if there was a Black provider, I don't know if they would stay. Mind you, Intermountain's definitely changed their tune, leadership, and how they're addressing diversity, makeup, and trying to have inclusion. They're one of the biggest funders of BPOU. But it didn't start with a positive experience. But they have, you know, right now they are supporting the Medicine Immersion Day. It is at their institution.
Right.
So they
Well, that
are,
That's kind of
maybe
amazing that you had that.
Oh, sorry.
That's
Jeanette.
amazing. You had a negative experience, and you know, you're like, this isn't okay. You know?
and that also could have
That
left.
is- my question actually stemmed from that because I know folks that have left, right? So,
Yeah.
you know, but as you said, the staying is what you know, that's how you get stuff done and how you make change happen. So more power to you for that, which is great.
You know, there is a stereotype that makes it hard for institutions here to recruit Black talent from the med schools to Steward, because associated with the state is it's got this kooky religion that people don't understand. It's based on stereotypes. You know, even at fellow LDS, they can go, I know a Utah LDS person, but often people are walking amongst Mormons, LDS all the time, East Coast, Midwest, you'd never know. And it's often a different stock when you're closer to Provo, it seems. And so it's seen as being less welcoming, not as open, but actually, you know, I live in North Salt Lake, very close to Bountiful, tons of folks here. And it's a great community to live in. They're very supportive of BPOU. They're like, do you need tables, chairs? Put my big O sign out in the yard when I have a social or an event or a discussion with docs. So I feel that actually the culture here is open to change. They want to do better. I feel the white folks here, especially those associated with church, want to do better. And that this is a space where, and also they care about, I've told everybody, Utah's going to Brown. And either you want to be ready to make people feel comfortable when they come into the state and seek care or work here, or do you want them to come for a year or two and leave? I stuck it out, and I almost left myself. After that experience with Intermountain, I went back to kind of doing permanent locums. And then I took a chance with Steward, a CEO there at the time, Jason Worthing, with their small health plan, eventually bought by the U. He took a chance on me. Very fair-minded. He understood the benefits and the value of diversity, not so much from a business aspect, but what it adds to when it comes to decision-making for a health system or a health plan. And so that is what kind of kept me here. And I've been able to grow from that experience. So being medical director to now CMO. And so there's other leaders like Jason Worthing and Brian Dunn, Arlen Jarrett, you know, who introduced me to Gregory Bell, who was my, you know, former lieutenant governor, who was my first person that gave a donation to BPOU. He wrote a letter of support for BPO for more grants. I mean, there are so many white allies in the state that have come up to me that are leaders, and they say, this group should have existed 15 years ago. I'm so happy it's here now. It's long overdue. Eventually I would love it where it's just physicians of colors, of Utah, or health, Black healthcare professionals of Utah. I would love to eventually change it because, I would want Latinos to kind of follow a same mission and initiative, because there's not enough Latino docs, I feel, here, but I can't speak from that experience. But one big thing is partnering with departments here, healthcare institutions, to say, we're here to support you. So if you have someone that you want to bring to the state and they're at Emory or LA, and they're, say, a Black radiation oncologist, have them meet with us. Have them have dinner with us. Tell them where it is. Give them our contact. Because if they're more likely to stay, just like I didn't with Intermountain. If I don't see often a Black face in the hall or in the lunchroom, or when I'm in any department meeting, how do I know that my value is being put forth? How I know that someone cares about my interests.
As you close, what's the future? What's the value you see here in your work?
I would say my goal is to try and get more legislation that addresses health equity.